Hello, hello. Welcome, everybody. So nice to see you all trickling in. New faces. Hello and welcome, familiar faces. It's so nice to see you again. I say this every time, but it is definitely my favorite part of these webinars. It's just seeing everybody. I say seeing you, seeing your names. It's lovely. I can see people still trickling in. While we're waiting, feel free to say hello in the chat. You can even drop where you are in the world. Definitely love to hear some of your biggest challenges around coaching clients for better sleep. We're going to talk about all kinds of things today. Welcome, welcome. Well, we've got a lot to unpack today, so we'll go ahead and get started. And as people trickle in, that's okay. So who are we? If we've met, hello. It's good to see you again if we haven't met. My name is Ashley Honeycutt. I am the Director of Health Coaching Operations here at YourCoach Health, as well as a board-certified health and wellness coach. It's my absolute pleasure to be here with you and discuss the important topic of sleep and how it affects our health and well-being. And spoiler alert, it has a lot to do with our health and well-being. And for those that we haven't met through YourCoach yet, it's my pleasure to introduce you to YourCoach Health. We are the only operating system for behavior change powered by health and wellness coaches. Our industry partners entrust us to stand up or augment their health coaching operations utilizing our APIs, widgets, and tech-augmented army of validated and credentialed health coaches to surround their existing product or service. We're the premier virtual home for health and wellness coaching, an ecosystem built to empower health coaches while expanding access to their services through our industry partnerships. So what does that mean for you, our coaches? This enables you to work in our HIPAA compliant platform, which is tailor-made for health and wellness coaches by a health and wellness coach. Our platform is designed to give you everything you need to run your practice smoothly. That's from HIPAA compliant chat and video sessions to session notes and a comprehensive library of resources, plus contracting opportunities with us for coaching with our industry partners for our verified and validated coaches that practice on our platform. At YourCoach, our mission is to create a world where every individual has access to a health coach by 2030. So in short, to help create more happy and healthy humans, which is exactly what we're here to talk about. Sleep. Why is sleep important? Sleep is not about just resting at night. It's a powerhouse for our well-being. When we're snoozing, our body gets to work. It's repairing tissues, it's growing muscles, it's releasing growth hormones. It's like a repair shop for our organs, our muscles, and our immune system. And we all know how much better we feel after a good night's rest. But sometimes that rest is not quite so good, and then the next day we can't focus. I don't know if you guys have experienced that. I know I definitely have. And that's because sleep and brain power, they're a power couple. When we sleep, the brain consolidates and organizes memories, and it makes it easier for us to learn and retain that information. Sufficient sleep is also associated with improved concentration, focus, and overall cognitive performance. Plus, we're in a better mood. Ever notice how you're crankier after a rough night's sleep? Adequate sleep, I'm making up words, sleep is essential for emotional regulation. Lack of sleep can lead to increased irritability, mood swings, and heightened emotional reactions. Sleep does wonders for our physical health too. It's associated with lower risk of chronic conditions, things like heart disease, diabetes, obesity, and hypertension. And sleep also plays a role in regulating blood pressure and glucose metabolism. Another benefit, a well-rested body is better equipped to fight off infections and illnesses. During those deep sleep stages, the immune system releases cytokines, which help in fighting off infections and inflammation. Also, hormones, the body's messengers also rely on sleep. Sleep plays a crucial role in regulating the production and release of hormones in the body. Disruptions in sleep patterns can lead to imbalances in hormones such as cortisol, which of course is the stress hormone, and ghrelin and leptin, which is appetite regulating hormones, and that can impact metabolism and weight management. It's a long list of things sleep impacts, right? Sleep and mental health are also closely interconnected. Insufficient sleep can contribute to the development or exacerbation of mental health conditions. So it's many things like anxiety, depression, and adequate sleep really helps in managing stress and maintaining emotional resilience. Sleep also allows the body to conserve energy and replenish its resources. So waking hours require energy expenditure, especially if you are on the go, you're busy, like me or a mom or a parent, you need all the energy you can get. And sleep helps restore those energy levels for the next day's activities. Quality sleep can also enhance creativity and improve problem-solving abilities. It allows the brain to make those unique connections between ideas and allows you to think critically. So the next time you need to be more creative, you might start with getting a good night's sleep. And last but definitely not least, safety. Sleep deprivation can impair cognitive function and lead to decreased alertness and reaction times. That can pose significant risk, especially when operating vehicles or machinery. So sleep is not just about counting sheep, or it's something that we do to pass time. It's about giving our body, our mind, and our emotions the support that they need to really shine and do their best. Now, when we sleep, it's not just one steady state. There's actually different stages of sleep. And it's important that we understand these before we start working with clients, just to give us a baseline. Not that we are going to be diagnosing or prescribing anything within these stages, but just for our baseline understanding to understand how sleep works and why it's important. So that's what we're doing here. We're laying that foundation for it. So sleep is divided into two main types. We have non-REM sleep, REM being rapid eye movement, and of course, REM sleep. So non-REM and REM sleep. Non-REM sleep consists of three different stages. We have non-REM stage 1, non-REM stage 2, non-REM stage 3. Really easy to keep up with, right? Non-REM stage 3 is also known as slow wave sleep. And then the fourth stage there is REM sleep. And that's a distinct stage that's characterized by rapid eye movements, usually vivid dreaming. So we're going to use a little analogy to walk us through this because it's very sciencey, and I love analogies. It helps me to understand them better. So hopefully this will help you as well. So we're going to think of non-REM stage 1 as like part of a nighttime symphony, right? We all think of these lovely lullabies that put us to sleep. So we're going to use a musical analogy here. And then we're going to break down how each of these stages contributes to the overall masterpiece of the symphony. So we have the opening movement. That's going to be non-REM stage 1. This is going to be the prep and settle phase. It's like the soft tuning of instruments before the concert begins. Your brain waves start to slow down a bit, your muscles relax, and you're really easing into the performance. This phase is brief though. It's almost like the conductor just tapping the podium before the music starts. Fun fact, this is also the stage where you might experience that sensation of falling. Now, as the symphony progresses, we're going to move into non-REM stage 2. This is going to be the harmonious lullaby. This is where the melody begins to take shape. Sleep spindles, and which is those short bursts of brain activity, they're going to dance like little musical motifs. Your heart rate is going to steady. Your body temperature drops a tad. You're really creating a rhythm that carries you deeper into the performance and into your sleep. Now, this is still considered a relatively light stage of sleep. Now we're going to move into the grand crescendo. This is non-REM stage 3, also known as slow wave sleep. This is the restorative overture. It's as if the orchestra reaches a big, powerful climax. Slow delta waves dominate the scene, and your sleep is so deep that waking you up is like trying to interrupt this breathtaking symphony. During the movement, your body orchestrates repair and growth. It'd be kind of like a musician fine-tuning their instruments during an intermission. And finally, we're going to arrive at the enchanting finale, REM sleep. This is the dreamy finale. Here, the symphony takes an unexpected turn, like a dream weaving through your mind, and your brain is going to light up with activity. Your eyes dance behind closed lids, and it's like you're watching the most imaginative part of the show. So this is usually where you're going to have your vivid dreams. Your body, save for those crucial functions like breathing, is completely still, and it's as if it's letting the dream unfold in a poetic encore. Now, fun fact for this stage, the body's major muscles are essentially paralyzed at this stage, known as REM atonia, and this prevents you from acting out your dreams. So you may be having vivid dreams where you're running or you're fighting. You won't actually do those body movements, and that's part of this REM atonia. So what happens when we sleep? We know we've got sleep stages, but what's actually occurring? Our brain doesn't just clock out. That's the good news. It's quite busy behind the scenes. And during the REM sleep phase, our brain tackles emotional processing and memory consolidation, which gives a boost to learning and memory retention. That rhythmic symphony continues throughout the sleep cycle, with the brain regulating the lineup of hormones and neurotransmitters that have significant impacts on our physical and our mental well-being. Now, while we may be lost in dreams, there's lots and lots going on behind the scenes, like we talked about. Tissues get repaired, muscles are built, the immune system gets the boost it needs, and not to mention the brain takes this time to declutter and expel any waste products and toxins that have accumulated while we're awake. It does all the house cleaning things it needs to do when it's resting, or when we're resting. The brain is not fully rested. And then as we snooze away, our body takes its own steps towards relaxation and conservation. And that's where both body temperature and heart rate naturally take a dip during sleep. And that fosters a state of relaxation that helps preserve our energy for the upcoming day. Sleep also wields considerable influence over our hormones, the biochemical messengers, and think of things like growth hormones, which is crucial for fostering growth and tissue repair, and melatonin, which is the conductor of our sleep-wake orchestra, and the one we're probably super familiar with, cortisol, and that sets up to manage stress levels. And memory. It's not just about storing facts. Sleep takes on the role of memory consolidation, where the brain tidies up the information collected during the day. And this tidy up of work allows for smoother learning and better retention. So when we say we're off to dreamland, we're actually setting the stage for a complex and vital series of processes that keep our mind and bodies ticking in harmony. So lots of good things are happening. But what are the consequences of poor sleep? So maybe we're not getting the full benefits, but are there actual consequences if we're not getting enough quality or quantity of sleep? Yes, of course. The consequences of poor sleep span across various dimensions of health and well-being. And really, if we have a broad, comprehensive understanding of the potential impact, it can help our clients overcome these, right? So consequences encompass things like an increased risk for chronic conditions. This can encompass a spectrum of ailments like cardiovascular disease, metabolic disorders, respiratory issues. All of these can potentially impose long-term health burdens. Also, sleep deficiency is frequently linked to an increased susceptibility to mood disorders. This encompasses things like anxiety disorders, depressive states, and this is because the intricate interplay between sleep quality and emotional equilibrium, it really underscores that importance of maintaining the healthy sleep patterns, because there has to be good balance between those. And if we're not getting enough sleep, it makes it difficult for that balance to occur. Also, cardiovascular conditions. Poor sleep patterns have demonstrated a noteworthy correlation with increased risk of cardiovascular disorders. The disruption of sleep cycles and related physiological processes can contribute to hypertension, arrhythmias, and an overall compromised cardiovascular profile. Diabetes and insulin resistance. When we have a sleep inadequacy, that can perturb the body's glucose metabolism and lead to insulin resistance. And then this disruption in glucose regulation may precipitate the development of type 2 diabetes or exacerbate existing conditions. Also, sleep exerts a significant influence on the regulation of various hormones critical for physiological homeostasis. Disruptions in our sleep patterns have been linked to imbalances in those hormones we talked about, things like cortisol, melatonin, and the growth hormone, which in turn impact our immune function, stress responses, and growth processes. Also, we can have some skin health integrity issues. Diminished sleep quality can impair skin barrier function, compromise wound healing, and exacerbation of certain dermatological conditions. Inadequate sleep often correlates with heightened stress levels and irritability, like we talked about. I know for me personally, if I don't get enough sleep the next morning, I'm a little crabbier than usual. And there's actually science behind this. Sleep deficiency impairs our body's ability to manage stress, leading to increased susceptibility to stress-related conditions and challenges in that emotional regulation. And then weight gain and obesity. There's a compelling connection between sleep patterns and weight management. Sleep deprivation can disrupt hormone balances, impacting the appetite regulating hormones that we talked about, and potentially leading to overeating and weight gain. So there's a lot going on here. Those are our increased risks. And then there are things that we know will actually be impaired as a result of sleep deprivation. So one is just fuzzy thinking. Poor sleep hampers memory, learning, problem solving, and decision making. It leads to sluggishness and difficulty concentrating. We can have weakened defenses. Inadequate sleep leaves our body vulnerable to infections and illnesses, making us more prone to getting sick. We can experience some clumsiness and slow reactions. Sleep deprivation can make us less coordinated with slower reaction times, increasing the risk of accidents. We can also see some additional danger on the road and at work due to reduced alertness, potentially causing accidents. Because remember, our response time and coordination is going to be impaired. There could also be a sluggishness in output. Lack of sleep diminishes work performance, resulting in decreased productivity and efficiency, and delayed recovery. So we know that poor sleep slows down the body's healing process, prolonging illness and recovery times. So sleep impairment isn't just about being tired or feeling tired. It can negatively impact our thinking, our health, our safety, our work performance, and our healing. So our overall health and wellness and well-being is really impacted by sleep. So how much sleep do we need? It's a complicated answer. It seems like a simple question, but it's a complicated answer, and it varies depending on the source of your information. So here we're going to look at the American Academy of Sleep Medicine's recommendations. You can see that we require sleep less as we get older. And by the time we're adults, we need at least 7 hours of quality sleep. Now, in a perfect world, we would all get those 7 hours easily, but that is not real life. Matter of fact, I would love, if you're open to it, just drop in the chat what a normal night of sleep looks like for you. I know different seasons of my life, it's been different things. When my kids were little, it was definitely less quality sleep because we were up a lot at night. Now that they're teenagers, it's definitely better, but we got a puppy, so now it's interrupted again. So 7 hours, though, is that magical time. So there are more sleep disorders that we could possibly cover in our hour together, but we're going to touch on some of the most common ones that we could encounter with our clients, aside from kids and puppies and all of those life events, but some of those diagnosable sleep disorders that clinicians may be working with their clients on, or they may come to you for help in. So one is insomnia. When it comes to sleep hurdles, insomnia absolutely takes the spotlight. Somewhere between 10 to 30% of adults encounter its tricky symptoms at some point in their lives. And chronic insomnia affects around 10% of the adult population. Another one you might be familiar with is sleep apnea. So that's like a breathing roller coaster during sleep. It affects about 10 to 15% of women and almost double that at 15 to 30% of men in the United States. So that's estimates by the American Academy of Sleep Medicine. And they actually suspect that 1 in 5 American adults aged between 30 and 70 suffer from sleep apnea. So it tends to cozy up with us the older we get, so older adults, with the odds increasing as we age. We might also encounter restless leg syndrome. So that's the sensation that makes your legs move or need to move while you're still asleep or trying to relax. About 5 to 10% of adults in the US know that feeling, and it occurs more for women, increasing in prevalence with age. You might have heard of narcolepsy. It's not as common, although I do feel like it's commonly talked about, like most people have a baseline for it. It does affect a tiny sliver of the US population, somewhere between 2 to 0.05%. So it is small, but it can be quite serious. So it's definitely worth mentioning here. And then we have shift work sleep disorder. This is going to be things that primarily affect medical professionals, factory workers, oil field workers, anyone who's on that shift work schedule. And we really see the numbers here shift, so pun intended, based on what kind of work the person is in. But one thing's clear, it's a challenge for a significant chunk of people juggling those non-traditional hours. And then of course there's sleepwalking and sleep talking, which affects about 3 to 4% of people, and sleep-related movement disorders. So things like kicking and twitching during sleep. Remember we talked about in that REM, how our body kind of paralyzes down and our muscles are not moving. Some people do experience kicking and twitching during their sleep, and that affects about 4 to 11% of adults. And so that's sleep-related movement disorders. So the question is, how can we as health and wellness coaches support our clients with sleep health concerns? So there's general tips that can potentially be used for any sleep condition or helpful for any client who wants to work on sleep. So we're going to cover those here, and then we're going to break them down by some of those most common sleep disorders we might run into. So some things that can help anybody who wants to improve their sleep. So maybe this is you, maybe it's your clients, but you can encourage regular exercise. So advocate for that regular exercise as it positively impacts sleep over time. We can help clients explore the best workouts that suit their body and their preferences. Potential areas to experiment with are cardio in the mornings and strength training if and when possible, avoiding rigorous workouts close to bedtime. Naturally, to stay within our scope as health and wellness coaches, we're not going to prescribe a specific exercise regimen, but we can provide resources and support the client in creating their own routine. We can also limit caffeine intake and educate them about that. Caffeine really has an effect on sleep, and we could encourage our clients to explore limiting the consumption, especially in the evening. We can help them identify other sources of caffeine in their diet. Again, being cognizant of scope here, providing education, but not prescribing them to reduce it. We can also educate clients on how and why to limit screen time before bed and potentially use blue light glasses or night mode on devices to minimize the impact of blue light on their circadian rhythm. We could talk about optimizing sleep environment. So this is going to be where we're creating a calm and our soothing sleep space by incorporating the use of darkening shades, soothing colors, comfortable bedding, and noise reduction. And then also paying attention to meal timing. So this is an opportunity to provide education about the circadian rhythm's influence on eating habits, maybe experimenting with eating their last meal at least 3 hours before bedtime to support better sleep. Lots of little things we can do there. We can also encourage a balanced diet. So this is going to be a diet rich in healthy fats, quality proteins, fiber-rich fruits and vegetables, whole grains, all of those things that are a balanced, healthy diet while avoiding processed foods and excessive sugar. Again, being mindful of scope here that we are not registered dietitians or nutritionists. Unless you are, then you're wearing that hat. But when we're wearing the hat as a health and wellness coach, we're not going to prescribe a diet plan to them, but we can give them resources on what a healthy diet looks like from CDC, Harvard MyPlate, all of these reputable sources. Along that same lines, if the client would like, we can explore the use of supplements like melatonin or magnesium, but definitely want to advise them to consult with a healthcare practitioner before starting any supplementation. We definitely do not want to recommend or prescribe any particular supplement. We can also teach them meditation or breathing techniques, introducing them really to mindful meditation, breathing exercises, things that are going to help reduce that stress and induce relaxation, which thus will help improve their quality of sleep. Also working on consistent sleep schedules. So really here, we can work on the importance of maintaining a regular sleep-wake cycle, even on weekends. This is the big fallacy that if you get short amount of sleep during the week and then you can make it up on the weekends, spoiler alert, science has said that doesn't necessarily work so well. So we need to create that regular sleep-wake schedule, and that will help to establish those better sleep habits. And of course, collaborate with healthcare professionals. If client sleep concerns are persistent or they're related to potential sleep disorders, recommend seeking guidance from healthcare professionals or sleep specialists so they can have a comprehensive evaluation and treatment. And then of course, we can work with them to implement those plans into their life. So let's start looking at some specific conditions and what we can do as coaches to help. So the first one we're going to look at is the one that probably is the most prominent and what we might run across the most often, insomnia. So this is going to be a sleep disorder that's characterized by difficulty falling asleep, difficulty staying asleep, or waking up too early and then being able to go back to sleep. So it's one of the most common sleep problems. It can significantly impact an individual's ability to function during the day. It can be either acute, which is short-term, or chronic, which is going to be long-term. And it can be caused by several different factors, including things like stress, anxiety, depression, lifestyle habits, medications, underlying medical conditions. There's a whole list of things that could be. So it's important to note that occasional sleep disturbances or difficulty sleeping can be completely normal and not necessarily indicative of insomnia. However, if the symptoms persist for at least 3 nights a week for 3 months or longer, it may be considered chronic insomnia and warrant further evaluation and intervention. Again, that evaluation and intervention will be done by their clinician. Insomnia manifests in a whole range of symptoms. It can vary both in intensity and duration, but the symptoms collectively shed light on the complex challenges that our clients may encounter with insomnia. So the first and most obvious is one of the hallmark signs. It's just struggling to fall asleep, even when the client is tired. The frustration can lead to tossing and turning in bed, trying to coax the mind into slumber. This is where we start seeing them counting sheep and all of these little tricks and tips, trying to get their brain to settle and go to sleep. There might also be disruptions in the continuity of sleep. So that's going to cause them to wake up multiple times throughout the night. And then that fragmented sleep pattern leaves them feeling groggy and unsettled in the morning. So your client may say, I don't understand. I slept 7 hours last night and I feel terrible. I woke up being really groggy and not feeling good. And this could be because they're having difficulty staying asleep. They're not cycling through all of those sleep stages. They could also have trouble staying asleep or waking up too early, right? So that falls right in line with that. So not only are they waking up frequently, but they're having trouble staying asleep and going back to sleep, or they may be waking up at what they consider an unreasonable hour. Maybe they want to wake up at 7 a.m. and they're waking up at 4 a.m. Right? So that could fall into insomnia. You could have an unrefreshed feeling. So despite spending hours in bed, they may wake up feeling unrefreshed and fatigued. And then that exhaustion sets the tone for the day, making routine activities feel burdensome. They may experience daytime sleepiness or drowsiness. It can be a significant hurdle, and the weariness can negatively impact productivity, engagement, and just the overall quality of life. Insomnia obviously takes a toll on cognitive functioning, leading to difficulties in concentration, focus, decision making. And of course, that impacts work performance, academic pursuits, and even routine tasks. There could be an emotional toll, so some mood swings, irritability, increased anxiety. It really becomes difficult to cope with those daily stressors when you're short on sleep. We know there's a compromised cognitive state. And then those mishaps that occur, those increased errors, accidents, lapses in judgment, they further contribute to heightened stress and frustration, which then snowballs into more insomnia symptoms. There could be a preoccupation with sleep because they want to sleep, right? And they become increasingly stressed about bedtime and the prospect of another sleepless night. And so then that heightens the symptoms as well, because now they're stressed and they can't get to sleep. And they may develop a dependence on sleep aids. So if sleep eludes them, they may resort to sleeping pills or other sleep aids to really induce that slumber. And then that reliance can create a dependency that exacerbates whatever the underlying issue is. Now, I think it's important to note here, clinicians may prescribe sleeping pills or aids to help them get through a time period, and we can absolutely work with them on medication adherence and how to incorporate those. We wouldn't want to ever advise a client to take or not to take their sleeping aids. That would be between them and their clinician, of course. Now, what are the risk factors for developing insomnia? Age. Insomnia is more prevalent among older adults as changes in sleep patterns and health conditions contribute to those sleep difficulties. Women are more likely to experience insomnia compared to men. So this could be due to things like hormonal fluctuations, pregnancy, menopause. In fact, women are 1.4 times more likely to experience insomnia symptoms than men. Poor sleep habits, irregular sleep-wake cycles, excessive screen time before bedtime, lack of physical activity. These lifestyle factors can contribute to insomnia. There may also be someone who works irregular or night shifts or frequently travels across time zones. They can experience sleep disturbances related to that disrupted circadian rhythm. An uncomfortable sleep environment, excessive noise, or an unsuitable bed or mattress can interfere with falling and staying asleep. Insomnia is also commonly associated with mental health conditions. So again, things like depression, anxiety disorders, post-traumatic stress disorder. So that can be a risk factor. Medical conditions, so things like chronic pain, respiratory disorders like asthma, gastrointestinal issues, or neurological disorders like Parkinson's disease, they can all interfere with sleep. Insomnia can have a genetic component, so if there's a family history of sleep disorders, that does increase the risk. There could also be the use of stimulants like caffeine, nicotine, or other medications, as well as the use of alcohol or other sedatives, which can disrupt sleep patterns. So you'll see in here, some are lifestyle factors, some are things within the client's control, some are not, right? And the good news is there is a whole lot here that as health and wellness coaches, we can help with. So there's lots of varieties of ways that we could go here. We're going to do a very small sampling of some tools or resources we could use with clients with insomnia. So first one I think is probably one of our most obvious tools, and that's encouraging clients to maintain a sleep journal. This allows them to track their sleep patterns, including bedtimes, wake times, sleep quality, any factors that might affect sleep, such as caffeine intake, exercise, energy levels, stress levels, bedtime routines. Are they sleeping at home? Are they sleeping at other places? And then analyzing that sleep journal together can help identify patterns and areas for improvement. Awareness is the first step, right? We're just getting curious and looking for those areas that clients feel like they can improve upon. We can also work on a sleep hygiene checklist along with that. So this is where they can evaluate their sleep habits and their environment. That can include things like creating a sleep conducive environment. What does that look like for them? What is their ideal sleep setting? Does it have blackout shades? Does it have a cozy comforter and blanket that they love? Is it a noise machine or a totally quiet room? And then we can help them establish that bedtime routine. And then we can also talk about all the other things. So maybe they're having a cup of coffee before bed, and really a nice tea might work better because the caffeine's affecting their sleep. That sleep journal is going to help us really to narrow some of that in as well. And when I say we, helping the client narrow it in, right? We can also do some breathing exercises. So think calming breathing techniques. One could be the 4-7-8 breathing technique. So that promotes relaxation and improves sleep. As a matter of fact, regular practice of the 4-7-8 technique can actually potentially aid quicker sleep onset. So if you're not familiar with it, I'm gonna give you a really quick breakdown of it. But the 4-7-8 breathing technique involves breathing in for 4 seconds, holding your breath for 7 seconds, and then exhaling for 8 seconds. So 4 in, hold 7, out 8. Breathing patterns like that induce deep relaxation by increasing the oxygen levels through breath holding. So the oxygen boost extends from the lungs to the vital organs and tissues, and then it restores balance and counteracts some of that stress-induced fight or flight response. Especially, it's beneficial for sleeplessness rooted in anxiety. It can help quiet racing thoughts and worries that hinder rest. It's also been known to soothe the racing heart and calm frazzled nerves, which of course aids in better sleep. So we can teach our clients these techniques and then help them incorporate them. We can also leverage accountability tools like progress trackers, goal setting worksheets, or regular check-ins, which, spoiler alert, if you're on the YourCoach platform, you have all of these at your disposal. You can set their goals, you can set to-dos for them, and you can check in regularly, all of those things. And that can help them stay on track with their sleep improvement goals. Of course, we can also do guided meditation and relaxation techniques like that 4-7-8 that we talked about, but even more guided meditation recordings or relaxation exercises that they can implement as part of their bedtime routine to really help them unwind and reduce stress and anxiety. And of course, we need to, when the situation calls for, encourage clients to consult with their healthcare professionals or sleep specialists, especially if there's underlying medical or sleep disorders concerns that might require that further evaluation and treatment. So again, whenever we do these collaborations with healthcare professionals, we're not just referring them out, we're adding to their support team, right? So it's really about giving the client all of the tools they need to improve their health and wellness. Sometimes we can do it alone. Sometimes we need that other person on our support team. So let's look at a case study. We're going to start with Sarah here. Sarah is a manager at a busy marketing firm. She's seeking the help of a health coach due to her ongoing struggle with insomnia. For the past several months, she's been experiencing difficulty falling asleep and staying asleep. She often lies awake for hours, feeling anxious and frustrated, and wakes up feeling unrefreshed and fatigued. The lack of sleep is affecting her productivity at work, her mood, and her overall quality of life. So lots of things we could look into here with Sarah. I always like to say, and I'll give this disclaimer because we're going to go through a couple of case studies. The very first thing we do with all of our clients is build rapport, right? Our clients have to know that we care about them, and they have to trust us enough to open up and be vulnerable and talk about these things. So we're going to focus on that rapport first. So we're going to assume that rapport has been set now. So once we have set that, that's going to be through things like active listening, really being empathetic to the struggles of insomnia. It's not easy, and it's not something to say, I want to fix it and poof, you can fix it. This is sometimes a longer issue to work through. So really being empathetic to those specific challenges, and then also the impact it has on her daily life and well-being. I mean, there's a lot going on here. It's affecting her productivity at work. So there may be some concerns about job stability. There may be concerns about her mood. She may be fighting with her partner or with her children. So lots of things could be going on here. So really creating that safe space for her to open up is important. I'd really want to get curious about her current sleep routines. So when she noticed those changes to her sleep, which came first, the chicken or the egg, right? Did the productivity at work start to slow down, which then caused stress, which then impacted her sleep? Or did the sleep start to degrade first, and then the cognitive decline happened as a result of the sleep, and then productivity went down at work? So a lot of curiosity questions we can dive into to try to help her get to the root of that. Also, what pieces of her routine around sleep does she enjoy? What does her bedtime routine look like? Does she have something that she really wants to keep in that routine that she feels like is working really well? What areas does she think maybe she could tweak and would benefit her to change? I'd also love to hear more about what a good night's sleep looks like to her. This looks different for everybody, right? If you're only getting 3 hours of sleep, then 4 hours of sleep is going to be fantastic. We're looking for improvement, not perfection, right? So we need to know what a good night's sleep looks like for her right now. Throughout all of those conversations, really being attentive to underlying stressors in Sarah's life, especially her busy work environment. We know chronic stress can significantly impact sleep quality, so we'll be curious about that. Curious about her current sleep hygiene practices. We can really dive into habits and lifestyle factors that could be contributing to her sleep difficulties. Here's a great place where you can leverage even the wheel of life. You can go through different habit patterns that she has. If you're into atomic habits, of course, there's the 4 stages you can use there. Really want to consider her emotional well-being through all of this. So particularly if anxiety or other emotional factors are playing a role in her insomnia. We will want to explore her caffeine intake and her timing. We could be curious about that because we know excessive caffeine can disrupt sleep patterns. And that's going to play into that habit when we're looking at her habit patterns. We can also look at this if she's doing sleep journaling. We can see the caffeine on there as well. Which brings us to some of those specific tools and strategies we can use. Again, sleep journaling. Sleep journaling is so powerful when we're trying to uncover what's going on with someone's sleep. It gives us valuable insights that can then guide what kind of questions we're going to ask, or where opportunities are to improve that sleep behavior. So first step to everything is awareness, right? And that's what that sleep journal is really about. We can also work on the stress management techniques like that 4-7-8 breathing technique we talked about. Any kind of relaxation techniques to help her manage that stress and anxiety before bedtime. We can also provide sleep education. So really, what educational materials and personalized sleep hygiene recommendations that might help her optimize her sleep environment and bedtime routine. That's going to be those things like benefits of blackout curtains, blue light, all of those things. We can also work on caffeine reduction plans, incorporating meditation with her, setting that soothing bedtime routine so that she can really signal to her body it's time to wind down and prepare for sleep, and sleep environment optimization. So things like adjusting the room temperature, minimizing noise disruptions, any of those things. So lots of directions we can go here. But as we learned, starting and understanding her experience and understanding what is most important to her and what a good night's sleep looks like is our best place to start, so that we can help guide her in a way that is going to be valuable to Sarah specifically. Now let's talk about sleep apnea. I think most of us might be familiar with this one too. It is relatively common, like we talked about. It's a sleep disorder characterized by interrupted or shallow breathing during sleep. And it occurs when a person's upper airway becomes either partially or completely blocked, leading to periods of reduced or paused airflow, which is apneas, while they're asleep. Now, these interruptions can last for a few seconds or maybe up to several minutes, and they may occur multiple times throughout the night. The brain's response to these interruptions is to partially awaken in order to restore proper breathing, but then that hinders the ability to achieve restful and rejuvenating sleep. Because remember, we need to cycle through all of those sleep stages, which non-REM 3 and REM sleep requires us to be in a deeper state, and the sleep apnea is going to keep pulling us out of that. So as a result, individuals with sleep apnea, they experience those disrupted sleep patterns leading to daytime sleepiness and fatigue. Now, there's 2 main types of sleep apnea. So one is obstructive sleep apnea. That's the most common form. It occurs when the muscles in the back of our throats relax excessively, causing the airway to collapse or become blocked during sleep. It's often associated with loud snoring or choking or gasping for air during sleep. The second kind is less common. That's central sleep apnea. And that's when the brain fails to send the proper signals to the muscles that control breathing. So there's a lack of effort to breathe during sleep. Now, unlike obstructive sleep apnea, Central sleep apnea is not typically associated with snoring. So in some cases, individuals can have a combination of both obstructive and central sleep apnea, and that's referred to as complex sleep apnea or mixed sleep apnea. Of course, this can have serious consequences if left untreated. It's a repeated episode of oxygen deprivation during sleep, and it puts strain on the heart and cardiovascular system. Clients can see things like increased risk of high blood pressure, heart disease, stroke, and other health-related conditions. And obviously, it impacts daily functioning. So there's going to be difficulties with concentration, memory, and mood, because remember, we're not getting that restorative sleep and non-REM free and REM sleep that we need for our brain to do all of that repair work. So what are the symptoms of sleep apnea? Loud and chronic snoring is the most common symptom of obstructive sleep apnea. The snoring is often more prominent during periods of interrupted breathing. There could be pauses in breathing during sleep. Now, these will often be followed by choking, gasping, or snorting as they attempt to resume breathing. People with sleep apnea may wake up with headaches. This is due to that oxygen deprivation and disrupted sleep pattern. They may also have frequent interruptions in their sleep, which leads to that daytime sleepiness, even after what they thought was a full-time rest. So this is that case where they're like, I slept 8 hours and yet I'm waking up so tired. Well, of course, because they're not going through all of those sleep cycles, right? That apnea is really impacting that. It can affect cognitive function, so difficulties with concentration, memory, learning. It can also cause irritability, mood swings, emotional instability due to that sleep disruption and daytime sleepiness. Again, that frequent nighttime wakings, which is often accompanied by a choking or gasping sensation, red flag for sleep apnea. And then some individuals may experience a dry mouth or a sore throat upon waking, and that's due to breathing through their mouth and all of the snoring that occurs. So what are the risk factors for sleep apnea? Obesity. Excess body weight, especially in the neck area, can increase the risk of sleep apnea as it can contribute to that airway obstruction. It's also more common in middle-aged and older adults, although it can affect individuals of any age. Men are more likely to develop sleep apnea than women, though the risk for women does increase if they're overweight or they have reached menopause. A larger neck circumference can also be associated with a higher risk of sleep apnea, as it can narrow the airway. Family history. This one I feel like is always on that risk factor list. And if you have a family member with sleep apnea, it's going to increase the risk. Of course, the use of substances that relax the muscles. So that's going to be things like alcohol, sedatives, certain medications can all exacerbate sleep apnea. Certain medical conditions such as hypertension, congestive heart failure, type 2 diabetes, chronic nasal congestion, all of those can increase the risk. Smoking. That's right, it's increasing inflammation and fluid retention in the upper airway, which is then going to contribute to airway obstruction. If a client has enlarged tonsils or adenoids, this can happen particularly in children. I know we talked about sleep apnea is more common in older adults, but enlarged tonsils or adenoids can really be a risk factor for children to have sleep apnea. And then chronic nasal congestion can make it difficult to breathe through the nose, which then increases the risk for apnea. So how can we help, right? This is what we always want to know. How as health and wellness coaches can we sit here and help our clients with sleep apnea? Again, sleep diary. Always going to put this on here because it is so helpful to tracking patterns, bedtimes, wake times, quality of sleep, symptoms. We can find out so much from the sleep diary, and it becomes an invaluable resource if they do want to go and talk to a sleep specialist. We can also provide education materials. So this one is really interesting because up to 80% of moderate to severe sleep apnea may be undetected. So providing educational resources and materials on sleep apnea, including things like its causes, its symptoms, its potential health implications, can really help the client better understand their condition and the importance of managing it effectively. We can talk about lifestyle modification plans. So lots of risk factors that are well within a client's power to change. So things like weight management, smoking cessation, support and goal setting around reducing alcohol or sedative use. These are all tangible things that clients can work on with their health coach, with us, to reduce their risk for apnea. They may have a CPAP, right? So this is a continuous positive airway pressure therapy. If they have one of these, then we can use a CPAP compliance tracker to help them monitor their usage and adherence to the treatment. We could discuss barriers to its use. We could set up systems for usage and meet the client where they're at, right? So sometimes we see clients who their doctor has told them to wear it all night, and they make it an hour in and they're like, this thing is driving me nuts. I don't want to wear it anymore. And they take it off and they just stop using it, right? Because they can't get the full 8 hours. They don't want to use it for a portion of that. And so we can really help them uncover those barriers. What pieces are most disturbing? Can we overcome those? What would success look like tonight? Maybe it is just wearing it for 30 minutes, right? We can work through those things to eventually get them to their end goal. We can also, help them review the data that they've logged on their CPAP compliance tracker or their sleep diary. So we can really help them to stay consistent and to garner awareness really of where they're at with their sleep health. And then, of course, referral to sleep specialists. If their sleep apnea symptoms are not well managed or there's concerns about treatment adherence, we can loop in and refer them to a sleep specialist for a comprehensive evaluation and adjustments to their treatment plan if it's needed. And then we can work with them on that specific treatment plan, helping them implement whatever the clinician's recommendations are. So let's look at John, another case study. John's a web developer. He sought the help of a health coach due to his ongoing struggles with sleep apnea. For several years, he's been experiencing loud snoring, choking episodes, excessive daytime sleepiness. His wife has noticed that he often stops breathing during the night, which is prompting her concern. And his sleep patterns are impacting his energy levels, productivity at work, and overall quality of life. Obviously, first, we're establishing that rapport and trust and seeking to understand John's experience with sleep apnea. How long has it been occurring? How does it affect his life? What has he tried in the past? What would improve his sleep apnea? And what would it mean to him to have it improved? We could discuss things like adherence to treatment. We would want to be attentive to any treatment that he's currently using. So if he uses CPAP therapy, we want to ensure he's comfortable with that treatment and addressing any barriers to compliance. If he hasn't worked with a sleep specialist, perhaps this would be a good referral in addition to the support team. Again, lifestyle factors, weight, alcohol consumption, sedative use, really some education around there, and maybe setting goals to help reduce or improve some of those lifestyle factors. We could work on stress and mental health. I'd be curious about any stress or mental health concerns that might exacerbate the sleep apnea symptoms. Managing stress is so essential for sleep improvement that this is a great area, regardless of what kind of sleep disorder we might be looking at, to really make an impact. He may not also be aware of the dangers of sleep apnea, so we could leverage resources with him to help him understand the potential health concerns of long-term sleep apnea. Shift work sleep disorder. This one affects, I feel like, a lot of clients. It's a sleep disorder that affects individuals who work non-traditional hours. So night shifts, rotating shifts, early morning shifts. It occurs when the body's natural circadian rhythm, which regulates that sleep-wake cycle, and it's based on a 24-hour day-night cycle. It gets disrupted due to irregular work hours. It's more common in individuals who work during the night or have frequent changing work schedules. The main characteristic of shift work sleep disorder is difficulty falling asleep or staying asleep at the desired times for adequate rest. Since the work schedule conflicts with the body's natural sleep-wake pattern, individuals with shift work sleep disorder often experience excessive sleepiness or fatigue during their work hours, and they may struggle to feel fully alert and refreshed during their off hours. So what are the symptoms? So trouble falling asleep, staying asleep, right? Excessive daytime sleepiness. We're going to see a lot of these overlap. This is where having them work with a specialist to really understand which sleep disorder it is becomes increasingly important. Shift workers often report poor sleep quality. So insomnia, that difficulty initiating or maintaining sleep despite being really tired. Impaired alertness and drowsiness during work hours can increase that risk of accidents and errors. Super important for our clients who will be working in the medical field, right? We don't want them having any impaired cognition while they're on shift. It's definitely important for everyone. And there could be mood disturbances again, and that decreased concentration and cognitive function. So what are the risk factors? Number one, non-traditional work hours, working night shifts, rotating shifts, early morning shifts. It disrupts that body's natural sleep-wake cycle. Extended work hours, so long ones, especially into the night, that can lead to sleep deprivation. Frequent and rapid changes in work shifts can make it difficult for the body to adapt to a consistent sleep schedule. Having an irregular, unpredictable work schedule, limited exposure to natural daylight during waking hours can really interfere with the body's internal clock and contribute to that shift work sleep disorder. Individual differences in circadian rhythm sensitivity and sleep preferences may affect the likelihood of developing shift work sleep disorder. Of course, being an older adult, we're seeing this through all of our sleep disorders and lifestyle habits. So poor sleep hygiene practices, all those things that we have talked about can definitely exacerbate these. But the primary symptom here or risk factor for shift work sleep disorder is going to be those non-traditional work hours and extended work hours. Now, it's also important to note they could have this along with insomnia or sleep apnea. These are not individual silos. Sometimes they do overlap. So the fastest thing to change shift work sleep disorder would be to have a more traditional work schedule. But we're going to assume that that is not an option. So clients, again, sleep diary. Gonna keep hammering this one because it is so powerful. Sleep hygiene education. So this is going to look different. A lot of people don't know how to handle or what to do about a non-traditional work schedule. Lots of resources out there that talk about how to get quality sleep during the day, which can be challenging, right? But this is a really good opportunity for us to provide some education and also help them promote those consistent sleep-wake times, even on their days off. This falls into that sleep schedule, right? So again, we can use the insights gleaned from the sleep diary to help craft some of the sleep schedule. Light exposure therapies. This is going to be where we explore the exposure to natural light during waking hours. And then we could work on ways to incorporate outdoor breaks during work hours to help regulate the client's circadian rhythm. This will fall into that education too on why light exposure can be really helpful. Fatigue management techniques. Fatigue is real during work hours, so you might want to explore with clients if power naps might be possible during their breaks, if what staying physically active could do for them, how to use caffeine strategically during their shifts, right? You don't want to be chugging caffeine for 8 hours straight and then expect to go home and go to sleep. So we can kind of work through some of that. Also strategies for the day off. Really exploring with the client how to adjust their sleep schedule on days off to maintain a consistent sleep-wake pattern whenever possible. Consistency is key. Our body loves consistency. And of course, establishing boundaries. So encouraging to set boundaries with work and social commitments to help prioritize sleep and self-care. So let's look at Emily. Emily's our case study here. She's a dedicated nurse working rotating shifts at a busy hospital. She sought the help of a health coach due to ongoing struggles with her sleep. For the past few months, Emily has been experiencing difficulty falling asleep after night shifts and staying awake during day shifts. Her disrupted sleep patterns are impacting her ability to provide optimal patient care and affecting her overall well-being. So a couple of things right off the bat, I think we get curious and explore together. Her sleep schedule consistency. So there's definitely a challenge here, and the inconsistency in her sleep schedule due to those rotating shifts is most likely affecting her circadian rhythm and overall sleep quality. So we could really hone in there. Also her sleep environment. So let's see if there's any disturbances or challenges in Emily's sleep environment that could impact her ability to rest during the day. So maybe she's working at night and maybe she has family at home during the day. The house is noisy, the house is loud. We could definitely explore that and some ways to mitigate that. Coping with stress. She's a nurse. There's going to be high levels of stress during her shifts, which can absolutely affect her sleep. So helping her uncover stress management strategies could be really powerful and a really good way for her body to transition from the stress of work to the relaxation of sleep. Again, I'm going to say it 100 times here, sleep diary, so helpful. That can really help her consider how her work shifts and rest are coinciding, and then also take into account how she's managing her days off. So within that diary, we could have that sleep environment optimization. So experimenting around with those blackout curtains, with the white noise machines, with a cool and quiet bedroom. It really gives us a tangible way to see what the changes are doing for her sleep. And then, of course, we could maybe explore light exposure strategies, stress reduction techniques, sleep hygiene education, all of those other pieces in there. One other thing we could also do is meal planning. Having balanced nutrition during shift work and really incorporating foods that support sustained energy levels and better sleep can be really powerful here too. Again, if we're going to stay within our lane as a health and wellness coach, we're not going to give them a meal plan or give Emily one. But we can help her with foods that will support sustained energy levels and better sleep without relying super heavily on caffeine and sugary products, which sometimes are the go-to to help boost energy, right? So we could explore all of those things. Now, for my favorite part, the science of sleep and health coaching. When we work with clients, we know the impact coaching has on them. We see firsthand how their sleep quality is getting better, how their overall health and well-being. We see them becoming happier and healthier humans in front of us. And while this evidence is wonderful, we want to look to also, what does the science say? What are these scientific studies uncovering? So, spoiler alert, it says health coaching can make a huge difference in the overall health and well-being. But even deeper than that, it can also significantly impact clients' sleep. There's a lot of powerful opportunity here. So we recently did a deep dive here at YourCoach into all things sleep. And you can find this on our website, actually. If you go to our website, yourcoach.health, click on Science of Health Coaching, you're going to see the opportunity for deep dives there. And there's a lot of them. I think we're up to 12 or 13 now on tons of different topics. So cool. But this one on sleep highlights a few cool things. And one is that results from a health coaching program to manage shift work disorder in nurses showed significant improvements in sleep hygiene, insomnia, depression, and anxiety compared to baseline. So when researchers measured changes in sleep for those who worked with a health coach and those who did not, they used the Pittsburgh Sleep Quality Index. You'll see that on here, that PSQI. Now, the confusing thing about this one is the lower scores denote a healthier sleep quality, and PSQI results showed that there were significant improvements for coaching participants since they have the lowest score on post-measurement. Now, the control group experienced an increase in PSQI, which means their sleep quality decreased. So health coaching makes a big, big difference. And another study aimed to see if health coaching could serve as an effective approach to improving sleep device adherence. Again, spoiler alert, it did help. Even in a population known to have poor adherence and among long-term PAP users with poor adherence. So it was a low-cost intervention for sleep apnea patients. As a matter of fact, people started using their devices more, about 9% more than before. And those that got health coaching were more likely to use their device compared to those who didn't. So 55% versus 41%. And people who got health coaching increased their device use by 0.4 hours more than those who didn't get coaching. So in general, health coaching and sleep improvements are a dreamy match. Further studies show a 23% decrease in poor sleep quality after working with a health coach and an 11% increase in quality sleep after just the initial weeks of working with a health coach. So this to me is so powerful because it tells us that we can see results quickly, right? When health coaches are able to sit in that space with clients to understand their experience, to be a part of their journey, to help them figure out little steps that are going to add up to super big changes. So again, you can find this research and so much more in the deep dive on our website. There's things this is our sleep one. There's ones on caregivers, women's and men's health. Our latest one is on dermatology. They're beautifully designed, easy to digest, chock full of research. Definitely check those out. And that brings us to our key takeaways. Sleep is vital. Absolutely. Getting the right quantity and quality of sleep is essential for overall well-being. Health coaches play a crucial role in supporting clients with sleep issues to improve their quality of life. And also, coaches must work within their scope of practice and collaborate with healthcare professionals when necessary. It's a beautiful thing that we can leverage professionals in different areas. It's all about helping our clients to have all of the resources and support that they need to improve their lives and become healthier and happier humans. So with that, we're going to wrap up our presentation, and I want to personally extend an invitation to you to join our coaching community. We have a ton of helpful resources available to help you manage your coaching practice. That's everything from our dynamic practice management platform to a coach's resource library folder. And this is a really neat thing within the platform because it has a lot of tools for you. There's Wheel of Life, Decisional Balance, lots of cool things. And after this presentation, soon there will be a brand new sleep diary that will be located there. It's a really neat resource that you can leverage with your clients to invite curiosity into their sleep health, really cultivate that awareness, we're super passionate about the health coaching revolution here, and we would be thrilled to have you join us on the platform and help us reach our mission of providing health coaching to the world's population. There's no cost to join, and you can access it through the App Store, Google Play, or any web browser at YourCoach.health. Now, before you go as well, I would love it if you would take a brief moment. Just you can drop it right in the chat on what topics you would love to see a webinar on. We provide these as a resource to you, to the coaching community, because we know how impactful health and wellness coaching is. So we would love to know what topics you would want to see. And that's just part of our dedication to supporting our coaching community. Also, if you registered for a CEU ticket, keep an eye on your email inbox over the next 24 hours for the link to the quiz. Again, we really appreciate your presence here today, and I want to encourage you to download the platform and be part of our coach community. Hope to see you on the platform soon. Have a great rest of your day. Bye, everyone.